Tonight, we will be discussing vaccines with Q&A. We had a guest speaker scheduled for this evening. Unfortunately, they were unable to attend this evening. So we are going to proceed with some of the common questions that we had received prior to this meeting and making sure that we are able to give some light and information on the current status of COVID-19 and the vaccines and the information we have available for that. If you have any questions, we are taking them in the chat area, or you can follow up with us afterwards, and we'll be more than happy to get your questions to our guest speaker for them to follow up and give you that information. All the presentation tonight will be recorded, so please, if you don't want to be on camera, make sure that you keep your video off. We ask that you please stay muted unless asked for asking a question. And we will be posting this information up on our website, on the Price Center website, as well as making it available to the email address that you registered at today. And with all that, I will now hand the floor over to my colleague, Arthur Charles.
Good evening, everyone. As Asia mentioned, we are going to do a prepared selection of commonly asked questions that we've received from community members and do our best to answer any questions you may have. To start, we did want to discuss just sort of where things are at currently in terms of infection. We are still seeing what's considered relatively high infection numbers on Staten Island. I'm going to go ahead and share some of those numbers with folks. So this is again, these links will be available on our website, which we will share at the end of this. But you're able to go to the state's tracker and get a sense of how different counties are doing. As of right now, Staten Island has had nearly 41,000 infected folks. And this is this week's infection rates compared to this week's testing numbers. So as you can see, pretty consistent in terms of the amount of positives we're seeing with a slight spike a couple days ago. So, and these are some statewide statistics just to give you a sense of where New York is doing in general. And we're seeing great turnout for testing, which is really great because, as you know, this Pride Center has been urging folks to participate in that activity, and it's a great way of knowing where we're at. As always, even though we are discussing a vaccine, we're also going to remind folks to do their part to reduce the spread before and after getting vaccinated. So whatever information we give you today, we really want to encourage folks to still take the same precautions they've been taking. Wearing a mask, keeping your hands clean, keeping your hands out of your eyes and your face and your mouth, avoiding social gatherings, avoiding indoor gatherings, and really keeping your travel to necessary places. So some of the questions we've been getting about the vaccine, first off, is just where is New York at right now? So as of today, New York opened up to phase 1B, which includes folks who are 75 years of age and older, and what are considered frontline essential workers as defined by the state. In this particular case, those essential workers are teachers and education workers, childcare staff, first responders, public safety workers, public transit workers, corrections staff, and grocery store workers. Prior to this and continuing still will be phase 1A, which were all forms of healthcare workers. This included home health aides and home care workers, pharmacy workers, as well as residents and staff in nursing homes and other select New York State authorized facilities, such as New York State Office of People with Developmental Disabilities, senior citizen homes, and things of that nature. So that's the current vaccine plan. These are the folks who are currently eligible to get vaccinated. And we're going to talk about where that happens and how to get that to happen for you if you're one of these folks. Going forward, the plan is that for potentially March or April, these are estimates, phase 1C will be enacted, which will allow vaccination for folks ages 65 to 74, as well as people with certain underlying health conditions, which are not yet released, but will be determined by the state. And any remaining essential workers, again, this is a determination that will be made by the state, and they have not yet released who that looks like. And then the final phase is phase 2, which will be for any remaining individuals who have not yet been vaccinated and under the previously mentioned categories. They would be available for vaccination in the summer of this year. Again, these are estimated dates, but that's what the state has said thus far. Speaking of, again, who can get vaccinated in the broader sense, The question we received was, who can get vaccinated? What will it cost? So all New Yorkers age 16 and older will have access to a vaccine once it is more widely available. Health and Hospitals, New York City Health and Hospitals has indicated that the vaccine is free for everyone. Even if you have insurance, your insurance may be billed, but you will not be charged for a copay or other fees like you normally would for a medical care visit if that is part of your plan. You do not need to share your immigration status to get vaccinated in the same way that you've not been asked to share that when you get tested. Getting vaccinated is not a public benefit under the public charge rule, so it would not impact your ability to be a citizen later on. When you receive the vaccine, your privacy will be protected. It is a confidential matter, and there are strict laws in place to ensure confidentiality for your personal information, as with any medical information. I just want to go back to this too, because I wanted to share briefly another one of the websites that are popping up. But Zoom does not always cooperate with my computer. Sorry. And we're going to have this website available. This breaks down the phases in very specific guidelines, and we will make sure this is available on our website for folks to access. But one thing we want to highlight in terms of the phase 1A and 1B folks is that New York State has opted into the federal program that has pharmacies providing COVID vaccinations. So under the federal program, employees from places such as CVS or Walgreens and other select chain pharmacies will vaccinate residents and staff in long-term care facilities like nursing homes, much like they do now with flu vaccine. So there were some questions around how this would be accessed for folks in those facilities. That's how that's going to happen. Okay. Will the vaccine only work for COVID-19? There has been some concerns about other variants of the COVID virus and the coronavirus. Research suggests that the vaccine for coronavirus is not going to be any less effective against the more transmittable variant that we've heard about in the United Kingdom or in England. Everything suggests that they would be effective right now in the research that is available. What are the different vaccines? People have heard that there are 2 vaccines. So to give some light onto what those look like, currently there are, yes, 2 vaccines that are authorized and recommended for use to prevent COVID-19. One is manufactured by Pfizer and BioNTech. They're similar in makeup. One requires, the Pfizer vaccine requires 2 shots with 21 days between the shots. The shot is given in the upper arm, in the musculature in the upper arm. It does not contain eggs, preservatives, or latex. These are common allergens that people ask about when they're getting shots. And it is recommended for individuals 16 years and older. The other vaccine that has been available is the Moderna COVID-19 vaccine. Again, it has a similar makeup in terms of it's an mRNA vaccine. It should also be noted that in the United States, other vaccines are being used. These are the vaccines rather being used in the United States. In other countries, you may have heard of other manufacturers. I can only give you information rather on what's available to us here. I should be clear in that. But one of the second manufacturer is Moderna. Slight differences include the fact that their shot is 28 days apart versus 21 with the Pfizer. But it's shot in the same place. It also does not contain eggs, preservatives, or latex. And unlike the Pfizer vaccine, the Moderna is recommended for folks 18 years and up. So there are some slight differences, but these will be the vaccines that are available as of right now. One question that's come up a lot, and I had this question myself, was should I get a vaccine if I've already had COVID-19? Yes, we want to really emphasize yes. Every federal and state level literature has informed us this is the best practice because it is possible to get COVID-19 again. You should get vaccinated. The vaccine will boost your body's protection that has already been built up as a result of being positive for COVID. We do want to highlight, though, that the recommendation right now is that if you've tested positive recently for COVID-19, you should wait at least, if it's been in the last 90 days, you should wait some time before getting your vaccine because it's unlikely that you'll get COVID-19 during the 90-day period from your positive test. Of course, these are recommendations from a website and from information being released by the city and state. Always talk to your trusted medical care providers to make sure the vaccine makes sense for you, especially if you know that you've been COVID-19 positive at some point. And if you do disclose that you are COVID-19 positive in the last 90 days, it should still be offered to you regardless of your infection status. They should not be requiring you to have an antibody test before you were vaccinated. You should be able to self-disclose, and that should be sufficient. And again, we want to make sure people are waiting within 90 days of their positive test. And current evidence suggests that reinfection with the virus that causes COVID-19 is uncommon in 90 days after initial infection. So again, these are just some of the information that's being provided so folks have a clear picture as to whether this vaccine will make sense for them if they've been tested for COVID-19 and they've tested positive. This is going to happen a lot throughout tonight's presentation. We are going to keep reminding folks to reduce the spread before and after they get vaccinated. So if you've tested positive for COVID-19 and you want to get vaccinated, you should also be following the expected guidelines for self-isolation, as we've outlined in previous presentations. Be wearing your mask, keeping your hands sanitized and clean, keeping your hands away from your eyes, mouth, avoiding who you interact with. Another common question that's coming up is, where can I get vaccinated? So we're going to show folks, again, we really want to recommend that folks go through New York City Health and Hospitals because they've been organizing the efforts to make this happen. And the criteria I mentioned earlier in terms of folks being able to get this vaccine for no cost and without disclosing any personal information that they don't have to disclose comes from them. So they're going to ensure that those guidelines are followed. The link that's on the PowerPoint is this website. Their website is very easy to follow and very easy to use. And one of the things that's going to be a great use whenever your phase comes up is having the ability to make the appointment as you become eligible. It's very easy to click, make your appointment. It's going to make sure you fall into the categories of eligibility. I do not, so I'm not going to go further than this page. But again, it's very clear, very straightforward. By phase 2, as I mentioned, that's when it becomes more widely available. You'll be able to get your COVID-19 vaccine where you normally get vaccines. So places such as your healthcare provider, a pharmacy, clinics, urgent care centers, but and they should be following the guidelines that we've outlined. But again, you can always go back to the Health and Hospitals website and the Health and Hospitals phone numbers to make sure you're getting it from a place that will follow those guidelines. Additionally, Health and Hospitals will be setting up community vaccine sites similar to the testing sites that they've set up in all 5 boroughs. And they will be a map available for those on the New York City DOH and the Health and Hospitals websites, and those will be sent out and shared as we have them. Some folks have asked if they should and why they should get vaccinated. Now, again, these are medical decisions that you should make with your trusted medical care provider. But in terms of benefits that we can attest to and stand behind, we do know that COVID-19 vaccination is a safer way to help build protection in your body. And COVID-19 will be an important tool to help stop this pandemic for all involved. Additional to that, wearing your mask and doing your social distancing will help reduce your chance of being exposed and spreading it to other folks. But that's not going to be enough, as we've seen. The vaccine will work with your immune system, so it will be ready to fight the virus if you are exposed. A combination of getting vaccinated and following the already established recommendations for protecting ourselves and others will offer great protection. So still following the mask and hand cleaning and distancing regulations. To stop this pandemic, it will require all the tools we have available to us. Experts are learning more and more about how COVID-19 vaccination may help reduce spread of the disease in communities. The CDC will continue to update and recommendations to protect communities using the latest science. So as we learn more about the vaccine and its effectiveness, these updates will be made and best practices will be updated. This has also been a huge question. Is the vaccine safe? Yes, in very plain language. And some of the reasons we can stand behind that statement is there has been the myth on the internet that you can get the COVID-19 virus from the vaccine. You cannot. This particular vaccine does not contain the virus. This vaccine is designed to teach your body's immune system how to fight the virus so it can fight the virus if you are exposed to it. Viruses of this nature are what we call smart viruses. So smart viruses can sometimes transform against your immune system. That makes them hard to fight off, which is why they have such long periods in your body. That's the point of this vaccination, is to assist your body in fighting off the smart virus, the COVID-19 virus in this case. The COVID-19 vaccine has gone through large clinical studies involving tens of thousands of people of various ages, races, and ethnicities. The evidence of those studies has been closely reviewed by the FDA and independent organizations. Researchers have been working on vaccines for coronaviruses for years, because remember, COVID-19, this is not the first coronavirus globally seen. So this didn't start from research that was brand new. Now, like all vaccines, individuals can experience allergic reactions. So again, regardless of the information I'm sharing this evening, you want to talk to your doctor about your individual needs and concerns. Additionally, as people are getting vaccinated, there's going to be expanded safety monitoring systems in place. The following systems informations will add those information systems will add an additional layer of safety monitoring, allowing for the CDC and the FDA to evaluate the COVID-19 vaccine safety in real time and make sure the vaccines are as safe as possible. The CDC will be using a system called vSafe, which will be a smartphone-based after vaccination health checker for people who've received the vaccine, and they'll be using text messages and website surveys to check in and make sure people are feeling well and safe. The CDC will also be using the National Healthcare Safety Network, which will be a long-term care facility monitoring system that will be reporting to folks who have been vaccinated and folks who are developing the vaccine. So there will be several databases in place for folks who are vaccinated to, again, monitor safety and long-term effects. If I get vaccinated, can I stop wearing a mask? The short answer is no. Nothing has changed in terms of the recommendations. More detail upon that is we don't have enough information to say if and when it will be safe to stop physical distancing and wearing face coverings. Until we understand more about the protection that COVID-19 vaccines provide, everyone must continue with the key prevention measures, which are staying home if you are sick, if you have COVID-19 or have been exposed to COVID-19, maintaining at least 6 feet of distance from people who are not members of your household or your bubble, wearing a face covering over your mouth and nose when you're outside your home, washing your hands often with soap and water, or cleaning with an alcohol-based hand sanitizer that we recommend you keep on you if you have it available, until we know further recommendations. So even though people are getting vaccinated, they're still going to be encouraged to practice these practices. So that kind of brings us to the end of the questions we had been provided by folks in the community prior. If there are any additional questions from those who are attending, we welcome them now. And I'll give that a minute. Okay. Oh, I do see one just as I switch slides. I see two. No question here, but thank you for such thorough presentation. Well, my pleasure. Okay. Thank you very much for that. Like I said, we will have information available to the community in real time, as well as this video will be put on our YouTube and our website. These are the links to the information we're able to provide to the community, which we update regularly, not just at the time of town hall meetings. And that'll be available to folks in the chat, as well as folks who registered will receive this information. If you're watching this and you got any useful information out of it, we really do encourage you to join us again for our next town hall, which will be February 8th, where we'll be focusing on, again, the updated information on the vaccine, as we expect the information will update regularly, where the city and the state are at with regards to COVID-19 infection, as well as offering support and looking at the impact of this particular pandemic on Black and brown men and men of color in our community, and how we can offer support as a community to one another and to them. Again, thank you so much for everyone who was able to join us, and have a wonderful evening and a great week.